One of the most memorable cases during COVID was when I actually diagnosed someone with ALS in the hospital. And ALS isn't something that we commonly diagnose in the hospital setting, but it can happen. In this case, this gentleman, if I recall, was probably in his 50s. He came in after multiple admissions of coming in for difficulty swallowing. And so this wasn't the first time in the hospital. I think he was tested for COVID multiple times, and the doctors just couldn't figure out why he was having trouble breathing and was just generally weak when all his viral panel and bacterial panels came back negative. As his disease progressed and he continued to be admitted to the hospital, I was consulted during one of these admissions. And I was actually heavily pregnant at the time. And I remember seeing him and noticing one of the big red flags when it comes to ALS, which is fasciculations. It's like a twitching that you can't control. And his tongue was fasciculating. And so in neurology, we actually have to take a detailed history. And so I had him go back, about when he thinks something just was amiss. And it actually was like a year before. He noticed he was a landscaper and he noticed that his foot was dropping. And slowly then he noticed that his arm wasn't as strong. But it wasn't until he started to have difficulty breathing that things really escalated. ALS isn't one of those diagnoses that we just give. We can say in neurology, especially hospital neurology, that we suspect it, but we have to get specific tests. And one of the main tests we have to get is called an EMG. We were able to, during the hospitalization, wheel him to a separate location to get it done. And unfortunately, that test did come back positive for ALS. And I remember talking to him, and one of the first things he told me when I told him it was ALS, I'm not scared to die. And he was the sweetest man. And he actually reached over to me with my big, big belly and gave me a hug. And it was just one of the most sentimental things ever, because here I was, like 8 months pregnant, being blessed and hugged by this patient who we both knew just had weeks or months to live. He was going to die. So this patient will stay with me forever. And I will always think of him and his family very fondly.